Hello and welcome to Focus on Liberia. My name is Dennis Jar and we are broadcasting from Atlanta, Georgia. Tonight, our topic for discussion is the healthcare system in Liberia. Our guest is Dr. Lawrence A. Zumo from the state of Maryland. Dr. Zumo will be joining us via video. Dr. Zumo, welcome to Focus.
Thanks much. It's always a pleasure to be on issues concerning about Liberia. I'm glad that you were able to invite me.
Dr. Zumo is a colleague, a fellow Liberian who lives in Maryland. He's a medical doctor. He got his MD. So he's MD in 1993 from the University of Liberia in Hungary. He also got his PhD in clinical neuroscience from the same university. Dr. Zumo, welcome to Focus on Liberia, where we discuss our Liberian healthcare sector.
I'm glad to be here so that we can discuss things about healthcare in Liberia. There are different aspects of this we can approach. We can hope to levy criticism where it should be, but we'll also offer some suggestions that we can use to go forward, comparing with our experiences from other countries that we've been to and have worked in. So I'm open for the questions, and we hope that people will take this in perspective, in kind, so that we want to really say something so we can help our country move from where it is to where it should be or where it should have been ever since.
I want to mention that Dr. Zumo, his university thesis, the title is Thymectomy in the Treatment of Myasthenia Gravis, a case study of 55 patients. He did his public health internship in 1995 at the Johns Hopkins Hospital in Baltimore, Maryland. Another internal medicine internship in 1996 in Queens, New York. A clinical neurology fellowship, 1997 to 98. Neurology residency in New Jersey in 1998 to 2001. He also a diplomate of the American Board of Psychiatry and Neurology in 2005. He was an associate clinical professor of neurology in 2013. Medical Director, Primary Stroke Center, Doctors Community Hospital in Maryland, 2016. The Dawson European Academy of Neurology. He's also a fellow of the American Academy of Neurology. Dr. Zumo has his private practice of neurology. He's married to Mrs. Jeanette Zumo since 1992 with two kids, Katseli Zumo, age 24, who's currently an applied economist at University of Maryland, and also Malika Zumo, age 15. Malika is an honor student at the Mount DeSales Academy. He's a rising 10th grader. Dr. Zumo, your CV is very impressive. Thank you for what you've done.
Thank you. We try to raise a Liberian flag wherever we go. We hope that will give inspiration to others to follow us and do better than what we have done, given the circumstances that we had to go on and what they can now do much better than what we can.
You are a neurologist. That's a big one. What do you do as a neurologist?
With major illnesses of the brain and spinal cord and the peripheral nerve. The main ones people will know are seizures, that's epilepsy, strokes, meningitis. We deal with headaches, fainting, which is my particular area. This is between seizures and neurocardiology. That's where I did my subspecialization. And so all types of fainting is my area. And neurology has to deal with multiple sclerosis, brain tumors, all of the medical aspects of nervous system diseases that do not involve surgery. And I'm also certified in psychiatry and pediatric neurology. I'm qualified in both of those, certified in neurology. So we do a whole gamut of stuff, and we deal with many issues that require final decisions by the neurologist. We are basically, we call us the doctor's doctor, because we ultimately are the one who are the diagnosticians in very difficult, complex cases.
Dr. Zumo, what are some of those disorders that affect the brain that you deal with? And let me make specific, and how prevalent are those kind of cases in Liberia?
From what I've read and what I've heard is that number one is seizure, because people from brain injury, from cerebral malaria, from the pen drivers falling off the pen bikes in Liberia, having all the severe brain injury, and stroke. Stroke is a very big one. Stroke is a worldwide epidemic now because of the nature of it. What it is, it's like 15 million people will have strokes per year. 1/3 will die outright. 1/3 will be significantly disabled. 1/3 will have some recovery. In Liberia, we wrote an article with Dr. Boba before he died, Abraham Boba, which showed a different demographic of strokes in Liberia. They affect the young. Really, he and I wrote an article which is called "Stroke: The Whip of the Young in Liberia," which is a very sad state because blood pressure, diabetes, blood pressure, cholesterol, those things are things that we can correct. And if that stroke is in the young population, then it tells us that epidemiologically we are not doing fairly well with those risk factor control. So strokes, seizures are the two major ones that I can think of here in Liberia. Meningitis number 3. We now have the meningitis outbreak. Liberia is no longer immune from the meningitis belt in Africa because Nigeria, Mali, Burkina Faso were affected. We had the first case in a couple last year or so where we had subtype C, which had not been in Liberia before. So we have that as something to contend with.
According to a 2016 statistics, we have 298 medical doctors in Liberia. That is, so you have, for a population of 4.5 million people, you have 298 medical doctors, making it a doctor-patient ratio of 1 to 1,500. It also says that specialists are very limited. You being a specialist, we have 207 general practitioners, 18 public health specialists, 15 pediatricians, 12 surgeons, 10 gynecologists, 6 dentists, and 4 family medicine. Talk to me about the specialist area in Liberia. How is that looking? Looking at you being a specialist, I don't know if you have some of your colleagues in Liberia that are specialists as well, and looking at a doctor-patient ratio.
Really, but to talk about the numbers, I think it is a tragic state of affairs because first of all, it doesn't have to be that way. There have been money pumped in the system at different levels, but they were either misappropriated or the health system was criminally funded. The ratio should be 1 to 1,000. That is what the WHO recommends for a normal functional society to have 1 doctor for 1,000 people. When I went to school in Hungary, they have 1 doctor for 300 people. Liberia's 1 to 15,000, or 1 to 1,500. That tells the 50 times more doctor per population, the same population than Liberia. Why is it so? Hungary is a country that has very little resources, but they are very savvy with their money. They love themselves. They take care of their general population health. This is where Liberia's resources, money should have been. We should not have 298 doctors, and the 298 doctors, half of those are not on the front line. They are in offices as ministers, deputy ministers, administrators, all like that. You only have about 20-30% of those people are doing really clinical work, which shouldn't have to be. But we'll always have a question, well, what are you guys doing? But the problem is, the WHO has pumped in Liberia, it has been misused and abused. And therefore, we keep using this number as some of the big other countries. Liberia has enough brain power to go to medical school, but if there's no funding, there's no way this can work. And so we have to do soul searching. The government officials have to really be serious about this. 1 to 1,500 persons, it is impossible. What the old joke is that if you have those many people, you just go and say amen and they sign the cross for them because you can't treat all those many people. We don't have to be in that state. But we have these are self-inflicted wounds.
Dr. Zumo, there are three basic accessibility. Are there, healthcare centers if people get sick to go? Is the healthcare, is it accessible? Two, if they are sick, can they afford it? Affordability, and then quality. Are the hospital treating people and getting them well? Are we getting the best outcome when you go to hospital? Looking at those three, what is Liberia's major problem? Is it accessibility, affordability, or quality?
A mixture of both, but I think more so in the Liberia situation is accessibility. We don't have enough hospitals to cater to the population. I'll give you an example. I deal with the Jamaicans quite often. Jamaicans have 330 health centers, 94 public hospitals. Leave out the private hospitals. Now, Jamaica has a population of 2.7 million people. They occupy a territory of 4,240 square miles. Liberia, on the contrary, has 2,000 square miles, 4.5 million people, and the amount of health centers are very few. Most of the quality health care is offered by constitutional hospitals like Firestone and all those. It doesn't have to be that way. It doesn't have to be that way. So the accessibility is an issue. Quality is an issue. And also we have the health belief system, which we'll talk about a little bit later, but access to care is not the way it should be in Liberia.
Good. So let me ask you for your general assessment of the healthcare sector in Liberia.
The healthcare sector, I would best say, is a medieval, rudimentary health compilation of ideas called a health system. We don't have a health system per se. Because they have a health system, there are four components you need for a well-functioning healthcare system. One, they have to have improvement of patients' health, the health of the community and individuals. Two, that health system has to defend the population against all ill health, meaning foodborne diseases, issues with emerging diseases, follow-up care. Those are all disjointed. Okay? The third part is that the healthcare system vis-a-vis the government must protect the individual from financial distress because of ill health. Four, they must provide a very concise mechanism for access to care. Those are the four major components of a functioning healthcare system. By that criteria, Liberia does not have a functioning healthcare system. Forget Ebola, this was before Ebola, because we have to be clear, the Ebola excuse was only temporary for those 2 years that it was occurring. So before and after Ebola, it was the same. The system is defunded. People are not having quality care because everybody in the hospital who's a minister, goes abroad. They don't have opportunity for the residents to train to treat local diseases. And that makes this a terrible situation that we should be all ashamed of.
So let's talk about the challenges more. Let's talk about the challenges and why do we have those challenges?
The first thing is that we'll have a look at the good governance and leadership. If we have people who are sincerely desirous of having a healthcare system in the society, because remember, the health of a nation is its first wealth. Two, if you go on a military theory, when you want to destroy a society in war, you attack three major sectors: health, education, and agriculture. Sustained bombardment of these areas will disable and destroy that country's infrastructure. To me, it seems that although there is no overt war But there appears to be a covert war against Liberia's healthcare, education system, and agriculture. Because of this, we have the challenges so humongous, so large that we think it is unmanageable, but it is not. We need brain power. Liberia has enough brain power, but it has been misused, misplaced, and abused.
Please explain on that enough brain power that has been misplaced and abused. What do you mean?
I mean that we have very talented young students who can be doctors, can be neurologists, like what I am, without any problem, because those kids are very, very eager to learn, but they have a poor health, poor education system. They cannot compete internationally. I wouldn't be able to compete as a neurologist in America if I didn't go to Hungary. But Hungary has a very precise method for teaching, and that can be replicated in any country. Liberia is not a school. But you have weaknesses in education infrastructure, weaknesses in experience infrastructure, weaknesses in the practice, and compound this, no financing. So if you don't have financing, you can dream all you want. You can have a doctor without adequate financing. You cannot have quality doctors. You don't have quality training. You cannot have quality hospitals. We can blame, oh, we don't have money. Like we have resources. It's all over on our feet. But we are still begging for money from everyone. So the brain power is there. Every country has a certain amount of brain power. Liberia has sufficient. Nobody can tell me that Liberia has brain power, but they are not educated in the right way. They are not streamlined. They are not led in the way of leading our country to the glory it deserves.
So, Dr. Zumo, what are the opportunities? Because there are a lot of challenges. Any light at the end of the tunnel?
One, the leadership of the country to look at the healthcare and say, look, we have terrible numbers. We gave you 3 months to sit down, figure out how we can put the disjointed piece of the pie together. That means the Minister of Health, the Director of National Public Health, the EPA, the Biomedical Research Institute, they must be put in one room together and say, look, after a week, we need some concrete answers as to where we have how we can get from where we are, because we are in a disgrace. It's done all the time in boardrooms, in the hospitals, in countries, and everywhere like that. We need to, and we're forced to think. When they are forced to think, we'll bring ideas out, and the government then must say, okay, well, look, how do we finance this idea? I'll give you an example. How do you finance the idea? All the ministers in Liberia, all the directors, all those who are making more than $1,000 a month, for national patriotic sake, to say for the next 3 months, we'll forego our salaries and put it to a healthcare fund. Just 3 months alone, you will see we'll get millions of dollars saved from the government to the healthcare. Now, that can say, let's see, what are the critical challenges? In this health center, we need hospitals, now medications. Liberia should be able to bargain with all these manufacturers abroad. Look, we say we've taken medicine from for so long, we can no longer buy a pill for $1. We need, for the next 2 years, we can afford $2. Waive your patent rights. That can be done. Then we have resources. We can hedge our fund based on natural resources and say, look, it's in the ground, we know this is how much we have. We'll peg a currency to that to raise some money very quickly. Do a GoFundMe. And all those guys who are making less than $300 a month should get that pay, or $500 a month should get that pay, because that's all they have. All the ministers can afford it. I can guarantee ministers can afford that thing in Liberia. I mean, it's well known. They might say, oh, it's constitutional, but it's well known. So getting that funding together, get an idea, put the fund together, and a national action plan put in place that we need to decrease maternal mortality, for example. In the next 3 months, we don't want to have 770 per 10,000. We need to bring it down to 15 like other countries. Okay, what do we do? Invest in the hygiene, in the medication, have people from other countries, doctors, who can come over and say, General, we need to see all the health checks, do routine health check, all that, blood pressure. We can do that very easily. A blood pressure cuff is $27. A pulse ox is $25. Let's do a campaign, educate and campaign, and get those health numbers down quickly. Let's look in the morgues. How many Liberians are dying in this time frame? How many Liberians have respiratory disease? Get those numbers, and we'll see the impact will be there. And there should be, I suggest, there should be an Inspector General of Health, because how is that going to be possible? This is the bureaucracy. What we do is cut down all the deputy minister, assistant minister, this and that, and all the big title, big name, doing nothing, no outcome, like that. Cut those things by about 1/3. Have a Inspector General, have 2 assistants for the east and the west of the country, and put all of the divisions together. Make a jointed healthcare system. Liberia right now is very disjointed, because everybody's making money off the process, and so the patients are not living better. And some people provide medicine are doing good. They make a lot of money and all this stuff. They're getting a cut and all that kind of stuff. So we can streamline and see and take our wasteness system. We'll be able to catch fraud and abuse. If you have one Inspector General there who reports directly to the President and the Senate simultaneously, without any fear or favor.
So Dr. Zumo, that is on the part of the government. What can the citizens do, including those of us that are in the diaspora, to improve the healthcare system?
What citizens can do, it will come to the issue of their health beliefs. I think they will help us more to believe that, look, diseases have a scientific basis and have medical treatment. There's a prevailing notion that certain diseases are not hospital treatable, that some are voodoo and all of these things. That is nonsense. We have to educate on the radio, and if people will say, okay, the people should live better, stop alcohol drinking, stop smoking cigarettes. That's a way the patient can change their lifestyle. But we all know in medicine, that's the most difficult aspect of changing the health dynamics in the society. But it can be done. And the second thing is that people have to be aware of their numbers, their blood pressure, their blood sugar, their cholesterol, their body mass index, their body weight, and how they feel overall. And they have those numbers so that then they say, well, I'm overweight, I'm underweight, blood is too high, and seek active medical care. Those are the things that citizens can do. Diaspora, what can we do? We have done a lot. We have a medical team in Liberia right now. Roberta Williams and co are there doing a tremendous job. But because the system is so much about gunk, we don't know what the impact will be. It will be only transitory. But diaspora physicians have done several. We send medical missions to Liberia. We send medication. During the Ebola crisis, we send medication. The Minister of Health at that time saw no urgency. That's a whole political issue on that side. But we in diaspora are willing. What we are not willing to do is to compromise with the prevailing structure in Liberia. That, well, this is the way it is, this is the way it's going to be. Well, we just have to just try and pray to God. No, that is something we cannot do. But there are others that we can do. And we, as President Weah has said, we can come to Liberia to help as diaspora if they are truly sincere. The last government was not sincere. They put roadblocks in our way all the way. But that's some of us just use basically a long distance approach to help Liberia. But if the present government is sincere that Liberians can come, they are welcome. There will be no obstruction to what we will do. They will listen to us. They will not be offended if we critique, but we'll also give suggestions. If they are willing to embrace that idea, that holistic approach, I think diaspora physicians and other healthcare people can come together and donate some time. But it has to be two-way street.
All right. Dr. Zumo, that last point, we were discussing in one chat room, and some were saying the idea that there are Liberians who don't embrace diaspora Liberian going back to work is a myth. Do you have specific examples of people that went back to work like you that were not allowed in the system to make your contribution?
Yeah, I will give you an example of Dr. Patricia Williams. She is a fellow physician, she's a fellow of the American Academy of Pediatrician. That's the highest honor you can get in the American medical system, the highest level of recognition. Born in Liberia, we wanted to help at JFK Medical Center, and she was told that her papers were not correct. Okay, so she said, "What should I do?" Well, you have to go to you have to work under somebody to allow you to see patients. You show her documentations. We take everything from America, but except when Liberia has a degree from America, you don't take it, you want to take somebody else over there. They refused for her to do because she had to subjugate herself as a fellow of the American Academy of Pediatrics to basically an intern. So that's an example. My example are numerous. I would take the whole time to explain to you. It was all basically because the Salif government and her son, being a physician, basically became a de facto minister of health in Liberia. And what he did do was basically, if he didn't go, or he didn't case his ring, nothing would do, or nothing would happen in Liberia. This is absolutely wrong, because in the time that we could have done something, many Liberians died. So the other issues, we send medications to Ebola. 2014, wasn't even moved by it. Our colleague on the ground Liberia right now, Roberta Williams, is doing all the best she can. They have all the cars in Monrovia. They can give her a car to go up country to take the medication. They want everything to be done by us. And we give the medications to them. They don't want to listen to us. And Dr. Baba, before he died, Abraham Baba, who was a junior classmate of mine, we worked to revitalize Liberian medical and dental journal. I wrote articles in it, and the two are available. I have one copy here. When they saw that I was associated with this journal, they did everything to stifle it. And Dr. Abraham Baba said, "Look, I need to find a different source to publish it." Because what do we publish is to educate, medical education, so that the level of understanding and knowledge can be brushed up. In Liberia, there are CMEs and the journals that we have. They want anybody else but a Liberian who at least issues some contrary position. They will make sure the blackboard. And that's what was the case in the past government, the last 12 years. So everything stopped in the last 12 years. They will say everything else. You had to go to Jim Salif, everything went through. But I am a fellow American Academy of Jim Salif qualification is not higher than mine. I cannot subjugate myself to James Salif because he is the son of the president. Absolutely no. And that is not going to happen. So if the present government is going to change the dynamic and understand our level of input, we are not going to talk down to people, but what is done wrong must be, if I go to medical mission to Burkina Faso, to Jamaica, to Serbia, I go to Poland, when I go to those places, they tell you, say, okay, well, we are here to work. Anything you see that we're not doing right, feel free, because this is how we all improve. And we'll do that easily. But Liberia becomes a very sensitive issue. So that's time is our work, and that makes it very difficult. But if the new government is open, has a different mindset, different direction, we are with it.
That's good. If you are just joining us, you are watching Focus on Liberia. We are broadcasting from Atlanta, Georgia. Our topic today is the healthcare system. In our next segment, we're going to be discussing mental health. So let's go back to Dr. Zumo. We want to discuss about patients. Patients do have rights. Even in this country, we have the Patient Bill of Rights. In Liberia, what are the challenges patients face? And do we have something close to the Patient Bill of Rights that we have here that talk about all the rights of the patients?
In Liberia, patients face a lot of indignities. I observe that in person, and we'll make a medical report. We'll always, on medical missions, we always get a report. The indignities still continue. People who are sick are talked down to. CNAs, nurses, and doctors are not available. And they talk down to the patient. Patients are not well educated to their rights, and even they have no rights. And therefore, they accept whatever the doctor will do. This is terrible because the oath is, Hippocratic oath is that, first of all, premier nil nocere, never do harm to the patient. talking down to a patient who was already sick, who was down on a dying bed or dying on a sick bed, talking to them back with nurses, speaking back and forth, don't answer the call pen, and talking cheek to the patient. That is terrible. Based on that experience and based on all the medical reports that I got from the medical mission, because I sponsored a lot of them, I sat together 5 years ago, brainstormed about 17 hours, and I wrote the patient bill of health for Liberia. I talked to Representative then, Gabriel Smith, Robertson Siawe, Akaros Gray, Bill 12. That is imperative that the Bill of Rights is passed. I based that on the American Association and the European Hospital Association. I wrote the documents, I sent it to them, nothing was ever done. It was going to dust somewhere. So the Bill of Rights in Liberia, as far as I know, doesn't exist. Although the documents I wrote technical statement, I wrote the bill formation statement, all of those are in my possession. But no action has been done. So as far as to answer the question directly, as far as I'm concerned, Bill of Rights patient doesn't exist. I can give you a copy of that so you can post on the physical library and see what we wrote in 2013 on that particular topic, and among other things.
We'll be glad to have a copy of the Bill of Rights that you author and see how we can share it with the current government or the Ministry of Health. So that leads me to my next question about medical errors. In 1999, the Medical Association here in the U.S. wrote a landmark article, "To Err is Human," talking about medical errors. It says 44,000 to 98,000 people die each year as a result of medical errors. So what comes, and this was 1999. Improvement have been made, but I think the numbers should still be around the same. So if medical errors is killing 44,000 to 98,000 people in the United States, what's about Liberia? Do we have any numbers on medical errors in Liberia? What has been done to bring the numbers down?
Are non-existent. I would think that the numbers are just terribly high. Why? We don't have no statistical database, although we have a Joe Statistical Institute that is supposed to have data with the Ministry of Health data, and all of those private hospitals that doesn't have. Well, we don't have those. So a way to cut down on this would be to have electronic medical record. I practiced this kind of for almost 20 years now, and before electronic medical records, we had medical errors mainly, and they were from the handwriting. We were writing everything by hand, and patients just were given the wrong medication doses. We've cut the handwriting issue out completely since two years ago. We have no more issue with medical error as a result of handwritten orders. From misapplication of medications, wrong medications, it's still there. But there has been a significant reduction overall, I think, in that direction. Liberia could do so very easily. We have medical records review, medical record audits. Here they have what they call a joint commission. They have those audits, and the hospital has their own policing agencies so that we can begin to have the numbers collected. But we have no central database collection. We have no central idea of what's going on in the hospitals. What happened? They keep the hush, except when it occurs in death, when the person no longer there, then people think, oh, well, it was something, whatever, but nobody really knows. But there are other injuries that the person dies later on. They have no follow-up of those issues. But those things can be corrected very easily if we have little resources. And it doesn't allow brain power, which Liberia has a lot of, and that has been streamlined and put in the right way. We can have it. But EMR is a simple electronic medical record system, and required reporting of deaths, disabilities. These reporting requirements are very essential for national health policy, for national discussion on financing of healthcare. So we have to have mandatory reporting, legible health right, and access to medical records. Patients in this country, in any other European country that have been, they have access to that medical record, and they can get it anytime. They should make that a law, or it should be not a law, it should be available to all patients. It's a patient record. Once you have that, somebody else can look at it, and then we can now put a pressure on the providers as to why this was done, what is not. This makes the errors to go down as much as possible.
Another issue is medical malpractice. I don't know if sometimes they say the laws are on the book, but what is being done about medical malpractice? Is there a place for patients to seek a recourse?
There should be, and I think Liberia should be serious about it, because the medical malpractice will put doctors on notice, nurses on notice, that if this is done incorrectly or they are harm as a consequence of the medical intervention, patients should have recourse, financial recourse, because it impairs their own ability to work, their own livelihood. So they have some of the courts in Liberia, they have laws in there. I don't know which court is doing that, but I just want to say in this regard, there should be one of those code C or code B to hear malpractice cases. Now, what does it take to hear successful malpractice cases? The lawyers themselves must be educated in area of malpractice. I don't know how well educated Liberian lawyers are in area of malpractice, because you will need expert witnesses, and you also will need the lawyers to know what is called standard of care. So the medical association can provide standard discussion about standard of care, but the lawyers can also have a secondary understanding what's standard of care, and they will match those two with a jury of their peers, so that the patients can have adequate education about their rights and compensation and punishment to the healthcare provider if that's necessary.
Okay. Dr. Zumo, thank you very much. Our time is winding down. I want us to quickly talk about the health ministry. Just in a few sentences, who makes a good health minister, and what your recommendations will be going forward to improve our healthcare system?
A good health minister should be somebody who is able to look at medicine holistically. In Liberia's case, now I'll preface it by saying that when I talk to this with others, they say, "Oh, well, you don't need to have a medical doctor, you don't have that." But Liberia's medical system is so rudimentary. If you want to see how rudimentary it is, how terrible it is, just read the book by Graham Gray, written in 1935, called General Maps. That is where we say what Liberian healthcare was then and compared to what it is today. Based on that historical analysis, what you will need is a pathologist who sees from the morgue, you will see the healthcare status of the population, or a neurologist because neurologists qualified like I am in psychiatry, pediatrics, public health, in internal medicine for the first in neurology, and all of this. So, but we can see the medical care holistically and point to where things would need to improve, and so we can cut waste, abuse, and fraud. A surgeon is absolutely not the right person to be anywhere near Liberia's Ministry of Health. The surgeon is all in the operating room. They don't have much knowledge about all the holistic approach to medicine. That is the wrong tool. That is one thing we should be clear. Never a surgeon as health minister. You have a pathologist and neurologist or well-trained pediatrician. Those will make a dent on Liberia's healthcare status.
Thank you. Even though we are drawing down the curtains, but there is I had a question here on the healthcare financing. There's a question here from a nurse, Kyle Kadar-Slaw. He said, "Dennis, please ask Dr. Zumo to throw light on the cash and carry system." So talk to us more about the Liberia healthcare financing system and what can be done to improve that.
Okay, the healthcare financing system, we have a lot of resources. But right now, Liberia has no money, for example. I would recommend that all those who are in the top tiers of the Ministry of Health, if it truly means good for that country, to say for the next 3 months, those who are making more than $1,000, to waive that money just to get a seed fund. 2, We have we have resources. We can go in the area now of the modern society with a cryptocurrency, where we say we have this kind of natural resources. We're going to use that to hedge the fund in a Bitcoin kind of situation. We need to raise about $700,000 We can do that. So, and then we fines, fees, like the people who bring foods in Liberia who that are expired, heavy fines. Those fines fund the health because they are making people sick. Okay, companies, royalties, the fees, fines, and then the people themselves, if they don't have money to pay for the healthcare, do it while it's on Hungary. In the days before Hungary became a capitalist country, they had who will go to the and bring fish, bananas or whatever. They bring it to the government warehouse, and they assess how much that money is. So when it's sold on the market, the money comes back in the healthcare system. So healthcare financing has to be done. Those are practical ways that we can look at healthcare. There are other ways, but we can talk about it at a different time. And then health insurance. Health insurance can be done if the the government said $2 a month for people who are in Liberia can have you have a person in the diaspora can pay to the health network so that when that family down here is sick, they will go and then we'll deduct that against how much they owe. Then you guys can pay the diaspora or what they can pay. So you gotta contribute there or locally. So we can, but you need some healthcare insurance. If you don't have healthcare insurance, we are running into trouble.
All right. Thank you so much, Dr. Zumo. I just want, for 30 seconds, your final thoughts. And one of the things they keep mentioning here is patients in Liberia, if you don't have money, you are not treated. You can be left there dying because you don't have money. But give us your final thoughts for 30 seconds so we can take our first break and join the next segment.
Yeah, Liberia's healthcare, we don't have, the patients should be working with it now. In America, with all the capitalist society, the hyper capitalism, a patient goes to the hospital with insurance, must be taken care of. You'll talk about the money later on. That is mandatory in all states of America. In Europe, the same. In England, as a foreigner, you go to England, you go there, you go to ER, you are taken care of, they'll send a bill later. But denying patient healthcare, it is a felony. It is a crime. Liberia has to be serious about addressing this crime. They'll say, well, why did the doctors did not get, they didn't go to school free. That's true. The government has to now go into the fund to pay for these people who have some insurance. Like, for example, I see patients, 20% don't have insurance. At the end of the year, the government looks and says, okay, well, you know what? We're going to pay for these people. Or we'll give you 50% discount, pay for this 20%. It's something that helps move the needle. That is, but saying no to a patient while having insurance, that's a crime. The government must make that a priority as soon as possible.
Thank you so much, Dr. Zumo. It's a pleasure having you. We hope you come back next time. And to our viewers watching, this is a focus on Liberia. In our next segment, we're going to be discussing mental health. Stay tuned. We'll be right back. Welcome back to Focus on Liberia. We are discussing the Liberian healthcare system. Our previous guest in the first segment was Dr. Zumo. Now, in our second segment, we are discussing mental health. I want to say welcome to all our viewers across the world. Welcome to all those watching on Twitter, on YouTube, or Facebook Live. With me as guest on this program for mental health is Mr. Dave Jah. Dave, welcome to Focus on Liberia.
Thank you for having me here. It's an honor.
Thank you, Dave. And by way of full disclosure, Dave is my brother. Dave is a clinical, is psychotherapy. Dave, in Liberia, they say you psychologize somebody. Please don't psychologize me here. Welcome.
No, that's not my intention.
All right. Dave graduated from the Boss Community College in 2003 with an associate degree in psychology. He went to Temple University and got his bachelor in psychology. Also, he went to LaSalle University with a master's in psychology and got his clinical, his license. He got his license in March 2013. He was licensed by the Commonwealth of Pennsylvania as a professional counselor. He has a training in CBT, DBT, and prolonged exposure therapy to treat PTSD. Currently, Dave is an outpatient therapist with the Northeast Treatment Center, NET, in Philadelphia. He also employed with the Philadelphia Mental Health Care Corporation as a clinician and case manager. Dave wants us to mention that he once served as a pastor in Soromianta Lola district in Guinea, where he also taught at the Liberian Refugee School in Guinea. He enjoys creative writing, laced with politics and the quest for social justice. He co-authored The Notebook of a Warrior, and also currently he's working on another creative work which is entitled One Nation Under Guns. It's expected to be published this year. Dave is married with 4 children, 2 boys and 2 girls. Dave, once again, welcome to Focus on Liberia.
Thank you. I appreciate it. It's an honor being here. I religiously follow your program, and I believe you're doing a good work. Keep it up.
Thank you so much. Let's start with understanding what is mental health. And I know there's another thing called behavioral health. So talk to me about mental health. How is it different or similar to behavioral health?
Basically, mental health generally is the overall psychological it's the overall psychological mindset of a person. How do you, in psychology, what we talk about is how do you think, what are the various factors that influence your thoughts, how you behave under certain circumstances like stress, and also what are the affects, what are the emotions that also come along with your thought process. So when you talk about mental health, basically is your overall functioning in your thinking, in your behaviors, and in your emotions. So mental health, behavioral health, those are words or those are phrases that you can interchange. And that basically over the years, the name or the connotations for mental health, it has changed. In time past, maybe in ancient time, people with mental illness were considered crazy, insane. Those are kind of unacceptable. These are pejoratory terms. So as time progressed, the name continued to change. So we would rather use the word or the phrase mental health instead of being crazy or insane. That's basically what it is.
All right. Great. All right. So that's mental health. So with all mental health. All right. Welcome to Focus on Liberia. We are discussing mental health in our second segment. And if you're just joining us, Focus on Liberia is on every Sunday at 6 p.m. Eastern Time, and we are broadcasting from Atlanta, Georgia. In our second segment, we are here with a guest, Mr. Dave Jah. who's speaking us on the topic of mental health. We had a microphone malfunction, so I want for Dave to again summarize what is mental health.
Okay. Again, thank you for inviting me. Mental health is basically the psychological state of an individual. And in psychology, when we speak about the psychological state of an individual, you are talking about how information is understood, that is, how we think about the environment, yourself, others, and how you think about your own state of mind. That's what is called cognitions. Then you have the affect, which are the emotions. How do you feel? And then based on all of those two factors, how do you interact? That is behaviors. So these are the three aspects that psychologists cover. And so mental health, I see it as a continuum based on at what level of that trend of the continuum that individual falls will determine whether he is mentally healthy or has a mental illness. So when you talk about behavioral health or mental health, those two can, for the most part, be used interchangeably.
So you spoke of a continuum. This means that all of us, basically, we have mental health issue, except where we are on that continuum.
Yes, I always like to think that way, that generally, in as much you have emotions, that is feelings, all of us experience sadness to some extent. We get angry. You worried about certain things.
I do.
It could be the bills. It can be stress from your kids. It can be marital problems. So we experience sadness, and this is how we have evolved, in fact, as human beings. So we have sadness, we have happiness, we have anger, we have loneliness. Those are called affects. Those are emotions that we all experience. But what makes the difference is how do those emotions impact your way of life? So an individual will experience all of those. How do they impact the individual life is what counts. If sadness overtakes you,
let's take a break.
It becomes a problem.
Let's break that. We want our technician. Please check their volume. Say the volume is low, and Dave is even lower than my volume. All right. So continue, Dave. And if the volume is still low, please don't hesitate to give us a feedback. Yes, all of us are crazy, except that some people are crazier than the other people.
Yeah, and in order for you to be determined as mentally ill, the behavior that an individual displays has to be unacceptable within some cultural sense. Okay, it's based on the culture and perhaps the values of the society. But that itself is not enough. A culturally accepted behavior or a behavior that is not culturally accepted can also be deemed as normal based on how it is perceived in the community. For instance, we as human beings, we go about, we have to dress ourselves. We don't go in public naked, but in some circumstances there are some people who walk naked, and it's acceptable in certain places based on the context in which to do that. So in order for you to diagnose someone with a mental health disorder, that person must exhibit a pattern of behavior over a period of time, and those behaviors must interfere with that person's quality of life. For instance, that pattern of behavior should prevent that person or limit that person's ability to work,
to build relationship, to interact with his community, then, and if that is over a period of time, it will be deemed as mental illness.
All right. So what are some of the things that mental health entails, and what are some examples if you say this person has mental illness?
Okay. So, and before we even get to that point, okay, you previously you had the neuro scientist also. There are about 4 factors that influence an individual's mental health: genetics, biology. In genetics, some mental health challenges or problems can be transmitted from one person to another. That is through the genes. Okay, one basic example we can give is we learned in high school about the Down syndrome. Okay, in biology, that is where certain chromosomes fail to divide. Okay, they form what they call a polyploid. Okay, but I'm not a neuro person right now. So mental health can be that through genetics, through biology. When we speak about biology, there are some neurotransmitters in the brain, as the neuroscientist was talking about. So certain neurotransmitter go awry, in the human person, has the result they are unable to maybe secrete certain hormones. For instance, what they talk about, the dopamines and all of that, which is associated with the pleasures of an individual. And then also there are environmental factors that influence, that impact a person's mental health. And I think that aspect is also critical about the environmental factors. So in relative to the environment, like for instance Liberia, as you alluded to in your first segment, Liberia has undergone a lot of environmental changes, a lot of environmental stresses. From the beginning of time, you talk about the civil war, even from the very foundation of the nation. Okay, then you had a brutal civil war. Prior to the civil war, we had coups that devastated people's lives. So those kind of factors have an impact on the mental health of people. Okay. And let me make that also clear that when we say that all of us are predisposed to mental illness, let's know that. But there are people who are more predisposed than others. And this is why you have 2 persons undergoing the same problems, the same challenges, and yet one may emerge as mentally challenged or mentally ill than the other person.
Right. Those environmental factors, especially coming from Liberia, and I want us to talk more about that. Give me some examples of mental health issues.
Okay. For our sake, the most that comes to mind would be depression, or bipolar. Bipolar basically talk about bi meaning 2, someone between 2 poles, and most of the time what you notice about the person is a high degree of sadness. Someone out of no reason, out of no maybe external circumstances that they can really point to, and this person is extremely sad, and that sadness prevents that individual from interacting with the community. Some people get so sad to the point that they stay in bed. They do not get outside, and that in terms impact it may impact their weight, their metabolism, that they are unable to even exercise. So And then bipolar, as I said, which is between two poles. There is also a manic state. Okay, you have the depressed state and then the manic episode. Maybe back home in Liberia, you will notice at some point, maybe we might have seen someone in our lives who suddenly wakes up in the morning and begin to scream. This person argues with almost everybody in his community. They fight. It could be. I'm not saying that that is generally a mental health problem, but it could be that the person has evolved to the manic state of that bipolar. So there's depression. There is anxiety. Anxiety is basically just being maybe fearful or anxious about almost everything. There is also PTSD, which is the post-traumatic stress disorder, which I think is likely to be prevalent in Liberia because it's associated with life circumstances. People who have faced tremendous challenges like abuse, like wars, violence that Liberians have encountered over the years, that has the propensity to impact people's mental health and lead to PTSD, the post-traumatic stress disorder. And also one of the biggest ones is schizophrenia, which is another mental illness that we don't generally maybe pay attention to. And in that, this person has high degree of delusions, hallucinations. Hallucinations basically where a person sees things or hear things or feels certain things, smells certain things that most people do not smell, and those things impact their way of life as well.
So why is there this, I want to say, the lack of emphasis when it comes to mental health? Because these things are very prevalent, but you don't hear them being talked about in the Liberian community and also in Liberia.
Well, I think part of the reason is that there is a lack of basic appreciation and knowledge about mental health. In the first place, I think culturally, mental health is associated with there is a lot of myth about mental health. I think for the most part, people who we see as mentally ill or that we call crazy, there is a belief about demons. Okay, there is that notion that people who displayed this mental illness somehow demonic. Some people believe that they are responsible for their own circumstances. And if you go to some areas in Liberia, you notice that it's associated with witchcrafting. I remember growing up as a child in the village or in the town. Someone suddenly developed a manic episode, or someone talks about hearing some voices that instructed that person to go or do certain things or say certain things. So, well, this person went to wish, and that